Patriots, welcome back to the Progressive Playbook. I'm your humble dealer, and I've been talking about how broken the US healthcare system is. In the last video, I mentioned that I think a single-payer healthcare system, also known as Medicare for All, would be the ideal system for the US. In these next 10 minutes or so, I'll give you 10 reasons as to why I think that, to show you how you can make a bulletproof argument for Medicare for All. In a previous video, I mentioned one of my fundamental beliefs is that I believe healthcare is a human right, not a privilege, especially in one of the most advanced countries in the world. So right off the bat, that's the first wonderful thing about Medicare for All. 100% of the population is covered. The way the bill is laid out, it takes the infrastructure of the current Medicare system, which is an incredibly popular program that routinely gets 70 to 90% approval, and simply lowers the age of eligibility. So right now you have to be at least 65 to qualify. The next year it would be 55, then 45, then 35, then eventually everybody's covered. And when you cover an entire population like that, you get number 2, no medical debt or bankruptcies. That concept just vanishes. Everyone is covered by a single payer, which is the government. And people tend to have this misconception that big government means less freedom for us. But here's the exact opposite. Medicare for All is the most pro-freedom plan. Why? Because number 3, you can go to any doctor you want. Gone are the shackles of networks. In a single payer system, every doctor is in everybody's network. So if you happen to get into a skiing accident in your vacation in Utah and mess yourself up real bad, don't worry about it. You're covered. Free at the point of service. And this is the point I was making earlier. It's not always the best idea to leave it up to the free market. Like, what's the innovation in health insurance? If you're sick, you should get help. If you're injured, you should get help. Nothing complicated about that. Let the government do that for us. It's important to note, though, that this keeps, number 4, innovation in the hands of doctors. Because now that the entire US population is in the network of every doctor in America, this is the most free market we can possibly create in the area where we want innovation. We have some pretty high quality doctors in the States. We want them to keep updating their knowledge of the medical literature to keep bringing us the best possible outcomes. We also want them to keep adopting new technologies like telemedicine, which can make medical care very efficient and also reach the remote locations around the country. Medicare for All is also pro-business in that, number 5, employers no longer have to cover health insurance. And this is across the board. If it costs less to hire people in the US, then these companies will put in more effort to hire locally instead of outsourcing. Really good for small businesses. And while we're at it, let's put up number 6, we get more freedom on how we make a living. Because right now, plenty of people stay at their job just for the health insurance benefits. But what if we don't like our job? Or what if we get laid off? Or what if we're trying to start our own business? In these cases where we don't have that steady income, we also have to cover our own health insurance, so we get doubly screwed. But under Medicare for All, this is no longer a concern. You're just covered. Now that you aren't as dependent on your employer, there is more incentive for your employer to treat you well to try to keep you. Okay, so far so good, right? This plan covers everyone, allows us to go to whatever doctor we want, binds us less to the employer, and reduces the cost burden on employers to hire more people. But how are you going to pay for it? That's the question everybody's going to keep asking you. But this is where it gets good, because number 7, Medicare for All saves us money. $2 trillion over 10 years, and that's according to a libertarian right-leaning Koch brothers funded Mercatus Center. A more thorough study from the Political Economy Research Institute of University of Massachusetts Amherst estimated that Medicare for All would save even more, $5.1 trillion over 10 years. So why would it save us so much money? A big part of that is administrative paperwork. See, under the current system, each person comes with their own different health insurance provider and different tiered plan, and doctors' offices have to spend time trying to figure out who's covered for what, how much the insurance covers, how much you'd have to pay out of pocket. It's a really messy system, but under Medicare for All, single payer, one insurer, far more streamlined. And what's more is, drug companies are also dealing with this single payer who represents all of us. When you have over 300 million people on one network, our collective bargaining power is that much stronger, allowing, number 8, the government to negotiate to drastically lower prescription drug prices, and also treatment prices. This is how we save even more money. And how do we see these savings? Because it is true that public taxes would go up a little bit under Medicare for All, but we pay 0 in private taxes in the form of co-pays, premiums, deductibles, or out-of-pocket expenses, right? These are effectively taxes. You currently have to pay them, but under Medicare for All, you don't. So the vast majority of us would save money. Maybe only a few people who are making millions of dollars a year would have to pay a little bit more. But these are also reasons for why public option wouldn't save money, because it costs us $175 billion more per year, and because we wouldn't be getting rid of the insurance companies. Instead, we would just be adding yet another payer using taxpayer money to which private insurance companies will try to dump all their chronically ill and older people on. So we'd be paying more in public taxes with no change in private taxes. So people might say, won't this make doctors' offices really crowded? Now that's free at the point of service, would people go to the doctor's office more often? To that I kind of say good. Right now there are a lot of people in the US living paycheck to paycheck who are too afraid to seek help because they're worried about the cost. Plenty of folks are rationing medicine. Guess what happens? They wait too long, and then their health issues turn chronic. And that leads to even worse health that is much harder, if not impossible, to reverse with our current medical knowledge. Just take cancer as an example, which has been my field for the last 10 years. It's way easier to treat somebody with early stage tumors, like stage 0, 1, or 2, than it is to treat somebody whose tumor cells have metastasized and started invading other parts of the body and forming new tumors. And at that stage of full-blown cancer, depending on the type of cancer, it's far more likely that the cancer wins out and kills the patient. So this next part is speculation, but I believe covering everyone will create a paradigm shift towards routine checkups, in which case we would invest more heavily in early screening, detection, and diagnostics of various diseases. This would be huge in disease prevention and in cost savings. In the recent COVID-19 pandemic, people got infected, and especially if they were older and or had chronic conditions that created complications, they were far more likely to die or suffer a lot to recover. At some point, hospital beds were full, people had to sleep out in the halls, there's a shortage of ventilator masks, so getting the disease is overall much more resource and cost intensive than not getting it. Prevention was the best bet. Vaccines were not a thing early on, but we had PCR tests. We could detect COVID in you at very high accuracy. A far cheaper strategy and far less suffering if people could self-quarantine to not infect their friends and family and anybody they contact. However, at some point, the labs were overburdened with running PCR tests. It could take days to get an answer, at which point you would already know that you had it. So then we started coming out with rapid antigen tests. They aren't as accurate, but they are generally good enough. There's a nice overlap between when a rat test reads positive and when you're infectious. So these things are way cheaper, faster, and more accessible than PCR tests. With this example in mind, my final reason for Medicare for All is it's a stable and universal system. Some people try to make this argument, oh, single payer only works in these other countries because they have a much smaller population, like 10 to 30 million people as opposed to 330 million people. But this is backwards. Think of it this way. If you get sick, you're pooling support from 330 million people. That is so much stronger. And what's more is, when everyone is on the same healthcare system, it is significantly harder to cut. Because whether you're rich or poor, everyone's on the system. Just take Social Security as an example. It's a universal benefit when you hit a certain age, and a lot of Republican lawmakers are eyeing to cut it right now, but that will piss off way too many people, so at the moment it's safe. Imagine how much more difficult it would be to try to make cuts to Medicare for All when 330 million people rely on it for their entire lives. And when we want to make improvements to our single-payer system, it becomes that much easier for us to collectively fight for it. When we have a universal system, we are saying quite loudly, healthcare is a human right, and this is the social contract, and we are invested in keeping everyone well. When people aren't well, it costs us all more money and more lives. And just as with the COVID-19 example, when there's a strong collective demand for innovation, to make doctor wait time shorter through telemedicine, to make infections manageable by rapid tests, this is where startups or corporations will aim to capitalize by bringing those innovations to market. And sometimes those innovations aren't new ideas. Sometimes they come from unearthing or instilling old ideas like exercise or not smoking or drinking or reducing sugar, fasting, or getting better sleep. Remember, one of my beliefs is that health should not be expensive. These are all cheap or free methods of improving people's health. So in the next video, we're going to explore this a bit more to understand some of the ways in which local, state, or federal governments can do this through policy. If you enjoyed this video, be sure to check out that one, and if you're trusting my voice on this platform, be sure to give me a hit of that LSB, like, subscribe, and bell, and I'll deal ya the next one.